Now let's talk about trigeminal nerve. This is the largest cranial nerve. Yeah. Now, have you heard of this term, Meckel's cave? And what do you understand by Meckel's cave? So Meckel's cave is also known as Meckel's cavity, trigeminal cavity. Trigeminal cave is a cerebrospinal fluid containing dural pouch in middle cranial fossa. Does this particular word remind you something? Dural pouch. Yeah, it is sector cerebellar. What do you mean by dural pouch? I want you to recollect something related to dura. Dura matter. What did we say? Yes, sinus, dural venous sinuses. Okay. So there is a vein between the two parts of dura. We studied that. It is called as dural venous sinuses, or there is a blood, the venous blood is flowing within the sinus. That is known as dural venous sinuses. Similarly, the dura gives space, or gives a space to the trigeminal cave. So the trigeminal ganglion. So that space given by the dura is known as Meckel's cavity. Okay. So this is where it is located. This is where it is located, and it is slightly posterior to the cavernous sinus location, and that's where the trigeminal ganglion is situated. Okay, we'll talk about the ganglion later on. So the ganglion gives rise to three main branches. Okay, three main branches, or three main divisions, we can say, not branches, we can say divisions. So the first one is what? Which one is the first one? The first one is ophthalmic, isn't it? So many of you now remember that ophthalmic comes out through which foramen or which fissure? It comes out through superior orbital fissure. Now it has further branches, frontal. So where does frontal go? Frontal goes in the the roof of the orbit, and from roof of the orbit, it is further going to divide into supratrochlear and supraorbital. Okay. There is also a nerve by name lacrimal, then nasociliary. So these are the branches of your what do you say? Your ophthalmic nerve. So ophthalmic nerve branches frontal, nasociliary, and lacrimal. So you have already seen that frontal and lacrimal along with trochlear. It's going to come or enter the superior orbital fissure through the lateral aspect. Okay, you have tried to recollect. You have studied this already. Okay, nasociliary comes to the middle part of your superior orbital fissure. You have studied that also, isn't it? Now let's see the branches of. Just mark and show you. Yes, some of you can answer this. So I told you the frontal nerve has superior orbital fissure, orbital nerve, supraorbital nerve, and supratrochlear nerve. The lacrimal nerve goes as such. What is this? Infratrochlear. Okay, branch of your nasociliary. What is this one? And what is this one? Can any of you name this? Anterior ethmoidal. Very good. And posterior ethmoidal. These nerves supply the ethmoidal air sinuses. Okay, clear? So this is regarding the branches and all the divisions of your all the divisions of your ophthalmic branch. So it goes out through the superior orbital fissure. Now let me mask that for you. Ophthalmic division is over, and mandibular division we will discuss later. So what is left now? What is left? So V2, the division or branch 2 of, or the second division of trigeminal ganglion, comes out through some foramen, which is known as foramen rotundum. isn't it? Okay, and it comes out. It's going to supply to some ganglion nearby. It is going to further divide into alveolar nerves. The posterior superior alveolar is there, anterior superior and middle superior alveolar is there. Then it enters the infraorbital canal. It comes out through infraorbital foramen as the infraorbital nerve, which is going to supply the lateral aspect of nose, upper lip, and upper teeth. Okay, that is all regarding maxillary division. Okay, and we will be talking in a bit more detail on your mandibular division. Okay, so let's just move on and see the picture on your right side. On your right side, it is showing not just the face, it is also showing you the areas which are supplied by your the various cervical nerves. So the C2 is going to supply this area. There is a lot of area which is being covered by your C2 and C3 together. So that includes the anterior part of your neck. So this much area is covered by C2 and C3. Now I have a very important clinical thing to teach you here. Just see this area. This area involves the skin or the area around the angle of mandible. So when you are doing an impaction, when you are doing an impacted teeth, sometimes you might get pain. There's impacted teeth here. Suppose it will be somewhere here, right? So when you are trying to operate or remove an impacted teeth, sometimes the patient will tell you a pain irrespective of whatever block you give. So that is because you have some fibers of this cranial C2 which are not anesthetized and which is giving a accessory innervation to that soft tissue or hard tissue of that area. Okay, so that is one important clinical point. Then not seen any medical or entrance questions being asked from this, but clinically that's a point. And what you do clinically is you give a deeper infiltration in that area to cover this nerve's effect. Okay, you don't give a second block, instead you give a deeper infiltration. Yeah. Coming to ophthalmic division, ophthalmic nerve is purely sensory. The branches are nasociliary, frontal, and lacrimal. The course, it leaves the skull, enters the orbit through superior orbital fissure, sensory innervation to the eyeball, upper part of nasal cavity, the skin of upper eyelids, forehead, front half of the scalp. Okay, so this is a different view of the same same one which we saw in the previous picture. It's a different view. So this shows the branches of first let's trace the frontal nerve. The frontal nerve comes out as the supraorbital and supratrochlear branch. Okay. Now next one is your nasociliary, which divides into the anterior ethmoidal nerve. Then you have the infratrochlear nerve, which is a branch of again nasociliary, and you have the small ciliary fibers also, which comes out through the nasociliary. And finally, you have the lacrimal nerve, which comes and gives supply to the lacrimal gland. Okay. Maxillary nerve. This nerve gives off a number of important branches which play a role in conveying sensory information. These branches are grouped based on their location along the course. The cranial nerves close to the origin of maxillary nerve in the middle cranial fossa. It is its smallest branch arises is the middle meningeal nerve. Pterygopalatine fossa, the middle, the middle course of the nerve at the pterygopalatine fossa on the east side of the skull. The maxillary nerve accesses the pterygopalatine ganglion and gives away a vast majority of its branches, that is orbital, palatine, nasal, pharyngeal branch, then ganglionic branch, posterior superior alveolar, and zygomatic branch. So major branching takes place at a place known as pterygopalatine fossa. This particular, these many branches are situated in that pterygopalatine fossa, and pterygopalatine fossa is the area where you give your posterior superior alveolar nerve block, PSA. Okay, so slightly more higher up, you get the pterygopalatine fossa. Orbital floor, as the maxillary nerve exits the pterygopalatine fossa via the inferior orbital fissure, it enters the orbit and becomes the infraorbital nerve. In turn, it splits into two branches, middle superior alveolar and anterior superior alveolar. And facial part, it has inferior palpebral branches, nasal branches, and superior labial branches. So what are they telling here? They have divided they have grouped the branches into the parts or into the location through which it is passing. So first it is like cranial nerves, then it is the pterygopalatine fossa, then it is orbital floor, then it is facial or the nerves in the face. Okay. So this is a rough course of maxillary nerve. The much easier one we had already discussed. So this gives a clearer view of both your maxillary and ophthalmic division seen here, but we can see the markings of maxillary given more clearly. Okay, same thing which we discussed in the previous slides. Now we will talk more detail on mandibular nerve. So mandibular nerve is made up of two roots, a sensory root and a motor root. That means your maxillary your mandibular branch is a mixed branch. You have motor and you have a sensory. So can you tell me the muscles supplied by mandibular nerve, the motor root? Can you tell me? I'll give you a clue. It is the muscles from the first pharyngeal arch. Yes, muscles of mastication, mylohyoid, tensor veli tympani, tensor tympani, tensor veli palatini, and the anterior veli of digastric, isn't it? All these come from the small motor root and sensory root. Sensory root, most of sensation in the mandible is by the mandibular nerve, including the tongue, including sensation from the tongue. So what are the branches? So there are branches from the main trunk. So you have a main trunk which comes out through your foramen ovale. So when you have a foramen like this, you have a foramen ovale like this, and you have a main trunk which comes out through the foramen ovale. So there's a larger main trunk from foramen ovale which comes out, and then there are two branches. So let this be the larger trunk. And you have a branch to the meninges, and you have a nerve to the medial pterygoid. So what is nerve to meninges known as? You know the name? It comes or it goes up through some foramen. It goes up through a foramen, a smaller foramen here. Yes, nervus spinosus, it goes up through your foramen spinosum. It's a small foramen. If you guys remember the picture, smaller foramen. And this is going to be a sensory supply to the dura mater. Clear? So meningeal branch is nothing but nervus spinosus. Then there is a nerve to medial pterygoid. Let's see what happens after that. Then the branches from anterior trunk, and then there is a branching from the posterior trunk. Okay. So let's see in the picture what do they mean by the anterior trunk and posterior trunk. Let's just move on to the next slide. So I told you the branches from main trunk, there are two, meningeal branch and nerve to medial pterygoid. So nerve to medial pterygoid is what kind of nerve? Is it a motor nerve or a sensory nerve? Nerve to medial pterygoid is a motor supply. Okay. Yeah. So this picture is from your Chaurasia. So let's trace the nerve. So let's see, you have the optic ganglion here. Yeah. So this is your mandibular nerve here, and this will be your trunk. What do you say for it? Your main trunk, and there should be a nerve which goes up, and there should be a nerve which goes to the medial pterygoid muscle. That is both not seen in this picture. So let's start with the divisions. So from here, it is going from this point, it is going to divide into an anterior division. So this one which I am marking in green is anterior division of your mandibular nerve, and this entire thing is your posterior division along with the lingual nerve. Okay, so I'll just round it better. I'll just round it. So this are your posterior division. Okay, so you have a posterior larger division and anterior smaller division. So let's clear the drawings. Just follow the spotlight. So you have an anterior smaller division. You see it's a thinner and smaller division, and posterior larger division. Okay, you have the posterior larger division, which again divides to the lingual nerve and the inferior alveolar nerve. Okay, so let's mark these and see where and all it's going to supply. So you have a mesenteric branch. As the name says, it is motor supply to mesenteric. This is from the anterior trunk. Okay. Then you have the lateral pterygoid. Again, it is a motor supply to the lateral pterygoid muscle. Temporal, motor supply to the temporal. And finally, this buccal. What does this buccal nerve do? Can any one of you tell? Any one of you can you tell? Sudeep. Okay. Okay. So those who have told me buccinator as answer, can you tell me buccinator is from which arch? It is developing from which arch? Second arch. And what is the nerve of second arch? Facial. So if you remember, you have already said muscles of facial expression supplied by the facial nerve, including buccinator, platysma, and all. You remember that? Okay, not skin over buccinator and all. Yeah. So, in fact, in the picture, even though in the picture it is shown, in the picture it is shown somewhere here. What is this nerve? Every one of you know this nerve. Have you heard of this name? Yes, long buccal. Amrita, you said it. Long buccal. Do you know where the long buccal is? And yes, near the lower third molar. So I will just draw you a picture. See, this picture, this diagram which they have shown is for a representation. So I'll show you another picture of how it approximately looks like. So I'll just draw you a mandible first. I'll just draw you a mandible first. So you have the teeth here, and somewhere around here you have the what do you say for it? Your foramen ovale, and this will be your nerve coming. So the anterior division will be somewhere like this. It comes, and the buccal nerve comes like this, and is going to supply the buccal mucosa till the second premolar, and this will send a small branch to masseter. This will send a small branch to the lateral pterygoid here, and then a nerve to the temporalis. This will be how the anterior division will be. So in the picture which we saw previously, in order to easily understand the anterior and posterior division, they have separated anterior division from the posterior division. So posterior division will be somewhat like this. It should come like this. There will be a lingual nerve. It goes somewhere like this. There should be an inferior nerve which goes and enters the foramen here. The foramen here. So when you get both anterior and posterior division on single picture, there will be a lot of confusion. Instead, what they did was they just separated it, and they showed you in a separate way. Okay, so don't get confused with this what they have shown. So this particular these particular structures should have come like this. Okay, but when you represent everything like this, it will get all mixed up. Oh, so there will be difficulty for you to study. So this buccal is nothing but the long buccal nerve, which is going to supply the mucosa over the buccal surface of third, second, first molar and the second premolar of your lower teeth. Okay, many of you made mistakes. Some of you told it is for buccinator. Remember, buccinator is from the second arch. Some of you told that it is supplying the mucosa of the upper teeth. So all those confusions come because of this diagram. So this diagram shows that the nerve is somewhere higher up. It is not higher up. It is along with other nerves. But for them to have ease to explain, they have just shifted it slightly upwards. Now let's talk about the posterior division. So posterior division, you have the lingual nerve anteriorly. It divides and it supplies the tongue. Okay, along with the branches to the submandibular ganglion. And then you have a nerve which is known as auriculotemporal nerve. So very, very important nerve. You know what is the importance of auriculotemporal nerve? One of this one of the things, yes, parotid, very good. We have already discussed about parotid. And another important question, important topic or important, what do you say, relevant thing, yes, TMJ. It is the nerve which supplies, sensory supplies to the TMJ. Okay. Gillies approach is not auriculotemporal, it is superficial temporal. Superficial temporal is an artery. Yes, gustatory, sweating, all those things are related to auriculotemporal. That is coming in surgery part. So I'm not, phase syndrome is coming in surgery part. So I'm not discussing those here. But anatomically, it is going to supply the area in front of the skin of your ear. In front of your ear, the parotid and your TMJ. Okay, that is more important. Okay. Now coming to the posterior division again, the inferior alveolar comes and it enters the foramen and it gives the mylohyoid branch below it, below the, just before it enters the mandibular foramen, and it is going to supply the pulp of all these teeth. Okay. So that's the anatomy of your mandible. I'll just go back to the previous one. Now this will be easier for you to understand. Branches from the main trunk are the meningeal branch. You know the name, it is nervus spinosus. Nervus spinosus goes back up to the cranium through your foramen spinosum. Then nerve to medial pterygoid. Okay, remember this very well. Medial pterygoid is from the main trunk. So you can remember it as M and M. Okay, you shouldn't forget that medial pterygoid is from the main trunk. And next is your branches which are from the anterior trunk. So you have the buccal branch. Whether this buccal is sensory or motor. Can you say whether it's sensory or motor? This one. Whether it's sensory or motor. Yes, others, please tell fast. It is sensory. Oh, why is the confusion? It is sensory. It is sensory. It is going to supply what? It is going to supply the cheek or the gingiva over the buccal aspect of lower posterior teeth. Okay. So don't hesitate to answer it. It's sensory. Now the anterior the trunk also supplies the branches of muscles of mastication, including the lateral pterygoid, the masseter temporalis. Okay. What about the branches from posterior trunk? So you have the auriculotemporal, the lingual, inferior alveolar, and you have further one more, that is mylohyoid. Okay. So that's simple enough, I guess. So this is the auriculotemporal nerve, which is the auriculotemporal nerve which goes up. Now this is going to supply the TMJ region. While going up, it is going to supply the TMJ region. Now this is a clear picture of your long buccal. You see how long buccal is coming. Okay. Yeah. So for this buccal nerve, you give a nerve block in this region, isn't it? Can you see it? Hope you can see that pink round which I've drawn. Can you see it? Okay, very good. So this is another view of that nerves. So this chorda tympani from facial, which carry the chorda tympani from facial, which carry the taste sensation, joins the lingual nerve, and it moves further, and it is going to supply the tongue. For the taste sensation of tongue